Welcome to Pennsylvania in Focus. I'm Kristen Smith. Legislators grappled with tough issues and each other as they pushed for clarity on the proposed 9.7% budget increase for the state's primary health agency. There were differences of opinion on the most important objectives in a field with need in every direction, frequently leading back to the perceived competition between rural and urban regions for state resources. Joining me today is the Center Square's Pennsylvania reporter, Christina Langell. Christina, according to Dr. Bogen herself, this was a tense hearing. While these conversations can get heated at times, it's unusual to hear a secretary make a comment like that. Tell us more about the tone of lawmakers' questions and what stood out.
I think that the lawmakers are experiencing a lot of stress around healthcare. I think that's happening at a national level because we are in a healthcare crisis, especially when it comes to staffing. And in Pennsylvania, that's a really acute issue. We have an aging population, so there are really pressing healthcare needs. And I think everybody is under a lot of stress when it comes to that topic. And people are being pulled in a lot of different directions because healthcare covers so many different areas. I think because of that, it was a pretty tense hearing. Also, you just had Dr. Bogen and her deputy secretary there. So it was just, essentially one person standing in for the entire state's response to all health related things. So it was a lot for, I think, anyone to sit through and be able to answer all those questions. I think to some extent too, because she is a doctor, she was a pediatrician and a researcher. To some extent, people are just kind of asking her medical opinion on topics that aren't necessarily matters of policy. Like, there were a lot of questions related to legalizing marijuana. That wouldn't necessarily be her purview. And then at times things were just kind of a little bizarre. Like there was a document in the materials that the Department of Health presented to the senators, and it had the maternal death rate in the state and the national goal. And the paper showed that our state was already below the national level, which is a good thing. But one Senator Coleman, really grilled her on why the goal would be for more people to die. And I think it was fairly clear that wasn't what the document was saying. So there were just a lot of weird moments like that seemed more perhaps tense than they needed to be.
Disparities in mental health and rural health care have long been the focus of new legislation. However, lawmakers seem to disagree about how much attention each issue receives, correct?
Yes. So that was one huge area of tension throughout the hearing. It started out more or less as you would expect, talking about rural health care. We had Senator Brooks, I believe, asking about whether or not, like, what kind of parameters there are around reopening facilities that have been closed, things like that, where senators are really pushing to get more access to care in rural areas. But then Senator Dush asked a question about the relative attention that rural healthcare gets and rural mothers get compared to Black mothers. There's a large disparity in Pennsylvania in the outcomes for Black women versus white women. They're twice as likely to die in the process of pregnancy through the first year of their child's life. So it's a really pressing issue that the state has put attention toward. I think it gets a little sticky because the implication that is at the expense of something else is where a lot of people take issue. Rural healthcare has been a major talking point, so it's not something that is going ignored with the legislature. In fact, one bill that they are passing through the House right now, or hopefully will pass through the House right now, that's intended to incentivize people to come move and work in healthcare positions in rural parts of the state. But that was introduced last year and didn't pass. So, it has been a focus. I can't speak as to why these things don't get passed, but it would be a little disingenuous to say that it hasn't gotten attention. It just hasn't received the votes that it needs. And I'm not really sure why that's happened.
Shapiro wants to legalize adult use marijuana to help fund his proposed spending increases. What were some of the concerns expressed about doing so?
Yeah, so this came up a lot because the Department of Health oversees the state's medical marijuana program. So they do have the most experience with kind of operating in this field in the state. However, I don't think it's expected that they would be in any way overseeing a recreational marijuana program. People do express a lot of concerns about this getting into the hands of children. Pennsylvania has more conservative rules within its medical marijuana program than other states already, in the sense that things like candy or other edible marijuana items that would be appealing to a kid aren't sold in our dispensaries. Additionally, you're not technically supposed to smoke marijuana in Pennsylvania. It has to be vaporized, although it is sold in dry leaf form. They don't sell things like joints, or they were talking about this in the hearing specifically that they're called pre-rolls, but it's essentially what, colloquial you would refer to as a joint. Those are sold in other states. They're not sold in Pennsylvania. And so the state does make an effort to make it unappealing to children, but that's a big concern. Another big concern that a few lawmakers expressed is that recent research shows that brain development continues till around age 25, 26. So people are concerned about, adolescents being prescribed marijuana, or even people in their early 20s. I think at that point, assuming the state's not going to change the age of adulthood to 25 or 26, there's not much to be done about that. And alcohol obviously also has effects on the brain, but that's a concern. Someone brought up driving under the influence. I don't believe that there are any current tests that can, positively say this person is high, which Dr. Bogen confirmed that she does not believe there are any tests like that, but that's an area for law enforcement to cover. And lastly, there were some concerns that Senator Martin brought up about smoking in public and, making sure that there are laws around that, especially when people do smoke dry leaf, even though legally they're not supposed to, but obviously they do. So that smells quite a bit, and it's obviously noticeable to children or other people in public spaces.
And how is DOGE impacting the department's budget?
So far, it's not. But Dr. Bogen says that about 60% of the Department of Health's funding comes from the federal level. So that is a lot. If cuts get made that impact the Department of Health, it will be a big impact. So things like WIC come entirely from federal funding. So does our emergency management funding. So, if there's a natural disaster, our response to that comes from federal money. But then Dr. Bogen also talked about some of the kinds of things that we don't necessarily think about, like if the power goes out at a nursing home and the state needs to respond and get people out somewhere where it's warm and where their needed machinery can function and stuff like that. That all comes from federal emergency funding. There's also their entire vaccine program is federally funded. The vaccine program allows people to walk into the Department of Health offices and get vaccinated or be tested for TB, stuff like that. In fact, she said they had to turn away, I think, over 1,000 people last year because they ran out of vaccine. So it's already a pretty stretched and in-demand program. And then there are lots of ways that, our health programming is affected by other institutions. People kept bringing up life sciences. And, we've seen cuts from the National Institute of Health. So as scientific research gets reduced, obviously then being able to apply the findings from that research and being able to develop and use new medication is dramatically altered. So that can hurt Pennsylvania industry and healthcare, although it wouldn't directly be through the Department of Health.
Christina, thanks for joining us today. Listeners can keep up with this story and more at thecentersquare.com.